your numbers on an absolute basis are not high, but the percentages are certainly scary. Can you give us an update on the current situation, hospitalization capacity, ICU usage, et cetera?
Thank you, Brian, for having me. First of all, great show. We're going through a surge. It's the Delta surge. We've seen this happen all across the country. We went from somewhat like 61 cases a month ago on average to 549 cases yesterday. So relatively speaking, it's a big surge. Of course, we're managing. We're a small state, though. We only have 1.4 million people. We had a surge last July 4th. Then we had one, as you show there, in January over the Christmas, New Year's holiday, and then now after July 4th again. It's all Delta. We are third best in the nation for vaccinations. We're at, I think, 68.7% of all of our population at least getting one shot. But those who are not vaccinated, which is a third of our population, are getting the Delta variant, and they're going to the hospital. They're quite sick. 91.3% of all of our hospitalizations are people who have not been vaccinated at all, and 97% of all of our cases are people who have not been vaccinated. So it's kind of playing out in Hawaii like it did elsewhere, and we'll make it through, but lots of people in the hospital.
This is an incredibly important point, Dr. Green, that you are making, because we are seeing things canceled. I'm going to a conference, by the way, next week. Everybody's required to be vaccinated to go to the conference, but there's still a lot of concern. And there is some breakthrough cases, but the numbers, let's be honest, they are very, very small. And the cases that do occur, they are, according to CDC and hospitals, very mild. Again, to reiterate, the folks that are getting sick and that are going to the hospital, they are over 90% the unvaccinated.
That's right, 91.3%. And it's a big problem because it's not just those who have COVID that are going to the hospital, but our hospital beds are filling up. And therefore, when I was on call this last Saturday, I treated a 74-year-old gentleman without COVID, fully vaccinated, had a big heart attack, and I was unable to transfer him for several hours to our main hospital here on Oahu where he needed cardiac care. So it has collateral impact when you have this many people in the hospital. So everyone across the country should be aware of that. I know there's been a lot of reporting in the South and Texas where some of their hospitals are closing. We're bringing in 550 additional critical care nurses and respiratory therapists to help support our state. FEMA is helping support us. But when you go through these surges, especially in small states, you really feel it. We welcome people to Hawaii if they're vaccinated and or if they get the pretest. So the pretest helps keep our numbers down. Only 2% of all of our cases have been travel related. Everything else has been community spread, but it's community spread amongst those who are not vaccinated.
That was my next question. I mean, I know it's sometimes hard to know exactly where the cases begin, right? But you know who's sick, but you don't know where they got sick. So it sounds like these are not people bringing in the virus from the mainland, JOJ, as they say, just off the jet, right? These are maybe family clusters in Hilo and Kona and Oahu.
That's right. So what it is, it's just between 1.5 and 2% of people who are travelers to Hawaii who were either had a breakthrough case or were unvaccinated. That happens very infrequently. And then about 11% of all the other cases that came were our own people traveling back from Las Vegas or Texas or Florida, beautiful places, but where they have a lot of COVID. They come back, if they were unvaccinated, they go straight into, quote, quarantine. But that quarantine means they're with their loved ones, their family, their coworkers, their friends. They spread it there. And then the other 87% is just pure community spread all across our state in those great places like Hilo and Kona and on Kauai and everywhere. So you can't stop this virus if you're not vaccinated, if you're not wearing a mask, if you're not doing smart things. And we now have decided to, like you said, decrease the number of people in restaurants and also decrease our total gathering size. 10 people indoors, 25 people outdoors in max gatherings. That will slow down the virus. We should see drop off in cases in the next 2 weeks, but it's going to be a tough 2 weeks for my physician colleagues and nurse colleagues in the hospital.